Broca's aphasia. What is Broca's aphasia? Broca's aphasia is the most common type of long-form aphasia. People with Broca's aphasia have damage that primarily affects the frontal lobe of the brain. They often have right-sided weakness or paralysis of the arm and leg because the frontal lobe is also important for motor movements. How is aphasia diagnosed? Aphasia is usually first recognized by the physician who treats the person for his or her brain injury. Most individuals will undergo a magnetic resonance imaging, which is an MRI scan, to confirm the presence of a brain injury and to identify its precise location. The physician also typically tests the person's ability to understand and produce language, such as following commands, answering questions, naming objects, and carrying on conversation. If the physician suspects aphasia, the patient is usually referred to a speech-language pathologist who performs a comprehensive examination of the person's communication abilities. The person's ability to speak, express ideas, converse socially, understand language, and read and write are all assessed in detail. Causes of aphasia. Causes of aphasia can be a stroke, a brain tumor, injury to the brain, infection in the brain, and progressive neurologic conditions such as Alzheimer's disease.
Symptoms of Broca's aphasia are poor and absent grammar, difficulty articulating sounds and words, problems with full comprehension, difficulty following orders. Broca's aphasia may say something like cook me instead of I want the cook. It omits certain words such as the, and is. Currently, there is no standard treatment for Broca's aphasia. Treatment should be tailored to each patient's need. Often, this is done by providing a board with various objects so that the patient can point to the object that they want. The prognosis for Broca's aphasia is that the recovery varies depending on the size and the nature of the lesion and the age and the overall health of the patient. Brain lesions in Broca's area may be related to slow recovery of aphasia in a patient with left hemisphere stroke. Some studies even say the potential for functional recovery from primarily expressive aphasia, such as Broca's aphasia, after a stroke is excellent.